Hi, I'm Dr. Weikart and I'm a dermatologist at Skincare West. When I treat people with psoriasis, my goal is to try and get your psoriasis as clear and controlled as possible. We are in an era of remarkable treatments, and my goal of controlling your psoriasis is definitely achievable. In this video, I'll specifically be talking about the biologic therapies for psoriasis. I will review how they work, how we get you ready for treatment, and what to expect while you're on treatment. Biologics work by blocking the inflammatory pathway that causes psoriasis and its symptoms. We call this class of medications immune modulators, since they regulate and normalize the abnormal inflammatory pathways that signal inflammation in psoriasis. If you also have psoriatic arthritis, a biologic can stop the pain, inflammation, and swelling of your joints, and can prevent the arthritis from worsening and causing more symptoms down the road. I've been treating psoriasis for 20 years, and there's no question that the biologic medications are among the safest and most effective therapies we have for difficult psoriasis. For many people, taking a biologic treatment for their psoriasis can be life-altering because it can control the symptoms where other treatments fail. Currently, there are 11 biologic products available in Canada to treat psoriasis. Several are also approved to treat psoriatic arthritis. Since some are also approved in children and in women who are pregnant, we have a few different choices. We will work together to find the right biologic choice for your psoriasis. Okay, here comes some science. There are 3 major categories of biologic treatments for psoriasis. These include the TNF-alpha inhibitors, the IL-23 inhibitors, and the IL-17 inhibitors. These are what we call the inflammatory targets, or the cytokines that the specific biologic is modulating. If you also have psoriatic arthritis, we will lean towards using a biologic that can best improve both your psoriasis and your psoriatic arthritis. But that's enough science for now. Getting you ready for your biologic. When we move forward to plan to start a biologic medication, you'll be registered with a medication support group that will help answer any of the questions you have associated with your treatment outside of your doctor visits. There will be blood tests to ensure that your general health is good. There will also be a tuberculosis test to ensure that you do not have previous exposure. We will be reviewing your standard vaccinations to ensure that they are complete. And there will be some short delays as we navigate the financial coverage of the medication through either the BC government or through your insurance. After this, you'll be ready to start. There are typically no regular blood tests required while you're on treatment. Getting started. The biologics for psoriasis are injection medicines that you administer at home. The support group will arrange a video or nursing visit to help you get started. Most patients can manage this easily. This is an example of an injection pen that contains the medicine. You would typically remove the cap, firmly apply pressure to the skin, either on the arm or the abdomen or the leg or anywhere where it's easy to reach. After applying pressure, the medicine is injected, there's a click, and then you dispose of the unit in a sharps container. How often do you need an injection? Some of the biologic injections are every 2 weeks, and some of them are only every 12 weeks, so rather infrequent. What are the risks of the biologic medications in psoriasis? Let's talk about potential side effects. First of all, where you inject the medicine, there could be a small amount of tenderness, but that goes away rather quickly. You should be aware that there is a small but increased risk of infections when you're on these medications. The risk is greater than if you were not on a medication like this, but overall the risk is quite low. If you do develop an infection, we recommend that you hold any upcoming injections until you are well again. One thing to avoid is live vaccinations, and these are generally offered for exotic travel, but they're also part of the childhood vaccination schedule, which we will review. Common vaccinations like the flu and COVID vaccine are considered safe and they are recommended. The biologic medications have very few other side effects, and the details will be discussed with you. Since there are no stress on your organs, no blood work monitoring is usually required, and that's a nice relief compared to some other psoriatic medications that we have. How quickly does it work? Patients with difficult psoriasis are very eager to get better control. The itch and discomfort can be very life-altering. The good news is that the biologic medications can work very quickly, but they still do take several weeks before we decide how well it works for you. We'll generally wait about 16 weeks or 4 months before we decide how well the medication is working for you. Many patients who start the treatment, however, see improvements within the first 4 weeks of treatment. How long will I be on treatment? Although the biologic medications are very effective, they only really work while you're on treatment. This is called a remittive therapy, and it's not a cure. It means that you should stay on treatment if you want the best control of your psoriasis. If you need to stop treatment, your psoriasis will slowly start to return after several weeks or months. So I hope this summary of the biologic medications for psoriasis was useful. Any further information can be discussed with your doctor at Skincare West.